Hello, my name is Dr. Kerry Kalis. In this session we will talk about liposculpture surgery. Liposculpture is not designed for weight control. It is no good for severely obese. It is no good if the skin elasticity is poor. It is best in localized fat areas and best when weight is close to optimal. The techniques of liposculpture. It's usually performed with general anesthetic. Small areas can be done with a local anesthetic as an outpatient. The tumescent technique involves injecting large volumes of local anesthetic into the area to be treated. There's usually no stitching. It usually means the patient can go home in 6 to 12 hours. There's often quite a lot of drainage of this tumescent fluid that is injected, which can be quite messy. A corset is applied and left in place for up to 2 weeks. It can be removed for washing, showering, bathroom, etc. The first checkup takes place at 1 week after the procedure. Of liposculpture. This patient shows generalized fat collection over the stomach area. Markings have been made prior to the procedure. The right-hand slide shows the post-operative outcome with an overall flattening and fat reduction in the stomach. In this case, you can see the excess fat collection around the outer thighs and inner thighs. The right-hand slide shows a post-operative appearance after liposculpture to these areas. This is the same patient, and obviously the images are taken from behind. An overall reduction can be seen in the fat collection over the outer hips and thighs. This case shows the improvement in the fat areas of the inner thighs and outer thighs. She's also had some significant weight loss. That's the same patient taken from behind. This patient has undergone abdominal liposculpture. This is the same patient with images taken from the side. See the overall flattening of the stomach. Here is another case of abdominal liposculpture. Same patient with the images taken from the side. This is outer and inner thigh liposculpture, side appearances, and back appearances of the same patient. This patient had her outer thighs treated, side view and back view. Note there's substantial improvement in the right-hand slide compared to the left. Liposculpture can also be used to treat some cases of fat upper arms, otherwise known as the batwing deformity. What can we expect from liposculpture? Firstly, there will be obvious swelling and bruising. There will be some pain for the first 4 to 5 days, and this will be managed and controlled with prescription drugs if necessary. There is discomfort. There is some itching, etc. around the suture lines. There is numbness for up to 3 to 6 months. It is possible in most cases to return to work after 3 to 5 days. No strenuous exercise should be partaken for 6 weeks. The final outcome won't be evident for at least 6 weeks to 6 months. We insist on the patient wearing compression garments for at least 2 weeks, but you can wear them for up to 6 weeks should you feel more comfortable. When it comes to organising your timetable, if your procedure takes place in the office, make sure there is a responsible adult to take you home. If it is done in the hospital, you may choose to stay overnight, or if you want to go home the same day, once again, a responsible person should drive you. Plan to take 7 to 10 days off work. Keep visitors to a minimum and rest is essential. Avoid strenuous exercise for up to 4 to 6 weeks, and wear the compression garments as already suggested for at least 2 weeks, but up to 6 weeks is occasionally preferable. You should stay within easy access to the hospital or our rooms in case you have a requirement for medical attention. Risks and complications of liposculpture surgery are fortunately rare. There can be numbness, painful scarring, recurrence of the original condition, asymmetry or contour irregularity, wound infection, and finally subjective dissatisfaction. Risks of surgery also involve risks of general anesthesia. There can be drug reactions, allergies, prolonged nausea, and respiratory problems. Your anaesthetist will detail these risks with you. Thank you for taking the time to listen to this presentation. Please don't hesitate to contact either myself or my staff should you require further assistance.